Many people are already en route to their Labor Day destinations, but the CDC is urging travelers to stay put. Of course, we got our medical expert, Dr. Kohli, joining us to talk about that and break down some other medical news. Thank goodness we have you here. So, Dr. Kohli, can you explain why people should reconsider their holiday plans to travel?
So first of all, I can't believe summer's already over.
I know.
You know, it just flew by. I would start by saying that the unvaccinated people need to stay put. I believe that the vaccinated people can travel safely, but they need to be careful about it. You can't be careless. You need to consider where you're going. Is there a high level of Delta there? How you're getting there. So are you going on a plane, which is higher risk, or are you going in a car, and who you're going with? In other words, are there any unvaccinated people in your party? But given those, I think you can travel, and I'm curious, are any of you guys traveling this weekend?
No.
No.
Are you guys? No.
Well,
Great answer, guys.
I'm going to Vail.
You're going to Vail?
Yeah.
You are? We need to talk. I'll give you all the details.
Yes, okay, and I'll talk to Murphy too.
So that is a perfect Labor Day trip because it's a road trip, and hopefully you're going with people that are all vaccinated,
Yes,
just like
going with
yourself,
one person,
right?
she's definitely vaccinated.
Perfect.
That's
I
neat.
approve.
All right, see, that's why I feel safe now.
Doctor's approval. All right, so this is about ivermectin. We all talked about it. You guys know about it. People have been warned not to take it. It's a livestock drug, right? Ivermectin for COVID-19. But many people in Oklahoma are being rushed to the hospital for this.
Yeah.
And some people with gunshot wounds aren't being able to be seen because of this, which really makes me angry. How are people getting it, and what can we do to prevent them from getting it?
So two ways. One is they're using livestock versions, actually, and taking it, even though it's designed for
So like
animals.
veterinarian medicine.
Yes. So because it's rural Oklahoma, they have access to these drugs for their cattle, their livestock, and they're using that. But the second, which disturbs me much more, doctors are writing for this under pressure. They've actually said they have 88,000 prescriptions a week, up from like 3,600 before all this started. So I think that that's unethical. A lot of doctors are actually lobbying to have those doctors punished or retaliated against for doing this. But I'm curious, what do you guys think?
What's the pressure? Like, who can pressure their doctor to write a script, and where are these doctors? No, I'm just kidding. But like, honestly, like, what kind of pressure? Like, just from the public, like, you need to write this or else?
No, it's the patient comes in and says, doctor, I have COVID, and I'm willing to try the monoclonal antibodies, but you also have to give me Ivermectin. It's a negotiation with your doctor, and the doctor sometimes says, well, if you think it'll help, let me go ahead and write it for you.
All right, we're going to do a hard turn here because we're going to talk about transgender women. Obviously, aside from them being murdered, there's a fact that they're more likely to commit suicide. Heart problems are contributing to them dying at a higher rate than the general population. How can you explain that?
So this was really surprising to me. This data just came out of Europe, and it tells us that transgender women are likely to die at a higher rate than cisgender women or cisgender men. And we believe that it may have something to do with the hormones to facilitate the transgender. Now, we don't know. We need more research. We also wonder if it has to do with access to care, if that may be a difference as well, or some innate biological differences, because this is all uncharted territory for us. We have no idea. So this really begs the question for me that we need to do better. We need to get more research, because this is a new disparity that we're now seeing in healthcare.
Wow. Yeah, that's surprising. Speaking of research, because we have you here, there is new research out that proves how low sodium salt can help prevent stroke. So what else should people with high blood pressure know for prevention?
Yeah, amazing, right? Sodium can reduce your risk of stroke by 14%.
Wow.
And cutting down the sodium can reduce your risk of dying by 12%. You can actually live longer if you eat less salt. So this study from Europe also looked at using a salt substitute, potassium chloride, instead of sodium chloride. And that does two things. One, it makes you pee out some of the sodium that you have, and the other, it kind of replaces that the sodium that you would otherwise take in.
How can I get potassium chloride?
You can go to the supermarket and get a salt substitute, such as no salt or any
What about
others.
sea salt? Is sea salt better than
I like
sodium
sea salt.
I'm really into Himalayan sea salt.
No. Salt is salt.
Yeah.
Salt is salt. You gotta cut it down, you guys.
Just because it's pink.
I do like that.
It's good. All right. Thank you so
Thank
much,
you, Doc.
Dr. Kohli. As always, if you, DBL Nation, have a medical question you want answered by our Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. Again, no panic, just prevention and precautions. We'll be right back.